Well, a record number of parents are calling out of work to take care of their sick children. Those numbers are likely to increase as flu season intensifies ahead of the holiday. So for more on this, I want to bring in CBS News medical contributor, Dr. Celine Gounder. So I presume it has to do with all these respiratory illnesses. Well, we have respiratory. What's going on that's got people calling out?
Well, we've seen a big spike in RSV and flu. COVID has yet to really hit this season, and a lot of kids are getting really sick. And then the issue is, well, what do you do for childcare? You know, if you can't send your child to school, a lot of parents are stuck having to stay home with their child, and that really takes a hit on people's pocketbooks. You have 3/4 of low-income women who do not have paid sick leave. So when they stay home, that means a lost paid check.
And, you know, we're talking about the spike in illnesses that we're seeing are like multiple day illnesses. Like it's not 2 days and then you can send your kid back. It could be a week, which is significant. And also, this is sort of happening at a time when a lot of these COVID policies that gave you a little more leeway, they're gone.
There was emergency paid sick and family medical leave early in the pandemic. A lot of people didn't even know that that existed and so didn't take advantage.
Yeah.
But for those who did take advantage of those policies, it really did make a difference. The U.S., we're one of the only developed countries, industrialized countries in the world that doesn't have paid sick leave.
Yeah, yeah. I was telling one of the producers that I remember the exact day that I got chickenpox because the kid that gave me chickenpox was off of school, but he was grocery shopping with his mom. And at the time, I thought, who would bring a kid grocery shopping? Now, I think, gosh, you probably had no one to watch this kid. Are you concerned that, you know, parents will be put in a situation where they just have to send their kid to school because they have no other options?
Certainly. And this is something we saw during the pandemic. A significant proportion of people, especially lower income, people of color, who just did not have the resources, didn't have childcare, didn't have somebody else to stay home with a kid, themselves might have been sick and couldn't afford to stay home. This is very common, and unfortunately what it does is it promotes more spread of the virus in the community.
That was going to be my sort of follow-up of what are the implications of that? And we're all getting sicker.
We're all getting sicker, yeah.
So let's just talk about, I want to ask you a doctory question, though. You're trying to protect your kid. There's all this stuff out there. You can't just bundle them up and keep them to yourself. So what can we do, particularly as we're heading into a season where we're going to be going to parties and get-togethers and all that kind of stuff to protect ourselves from some of the illnesses that are going around?
Well, if you're sick, stay home if you can afford to, right?
Right.
That's definitely one of the most important things. If somebody else, you know, in your child's play group, for example, is sick, you might want to be canceling some of those play dates. And then we do know masks work. There was a study looking at what happened during the pandemic at schools in Massachusetts, where they had some schools that still mandated masking, others did not. So you're comparing similar time periods. And we definitely saw a much lower rate of infections among both staff and students when they were wearing masks. So they work.
You know, if Vlad was here, he would say, when you go to Asian countries, people wear masks if they're sick. It's not that big of a deal. Or if they feel a little under the weather, they throw a mask on. I don't know, are you hoping that maybe after going through COVID, we have an increased comfort level with this sort of behavior? Do you think we would benefit from that too here in North America?
I think we would benefit. Whether people are willing to do it, I don't know. I mean, I wouldn't sneeze in somebody's face, right? I wouldn't cough in somebody's face. And is masking when you're sick really that different from covering your cough or your sneeze? I don't think so, but I think people are really, they want to do what everybody else is doing. And so if other people are not doing it, they may not feel comfortable doing it themselves.
Do kids get flu shots? I don't even know if they do.
Yeah.
Oh, is it too late now that we're already in the season?
No, it's absolutely not too late. So starting at the age of 6 months, kids can get flu shots. Absolutely should get a flu shot this year. It's a very good match for what's circulating out there, so will make a big difference. And so that, you know, that is a really good solution to prevent some of these, is to get your kid vaccinated for the flu, for COVID. You can at least prevent those two, if not RSV.
Yes. Dr. Celine Gounder, thank you so much.